I am an assistant professor in the medical college, and I will be with you for the next, hopefully for the next 3 weeks, talking about 3 different subjects. In addition to the clinical enzymology, we will talk about the cancer and the tumor marker and liver and kidney function test. So let us start with clinical enzymology. The objective of these lectures is that you will be able to describe plasma enzyme, explain about the assessment of cell damage and proliferation, describe the role of enzyme in a healthy and disease condition, explain enzyme application in diagnosis, prognosis, treatment, and biotechnology. So the content of these lectures will include introduction, enzyme of clinical significance, enzyme of and disease diagnosis, and enzyme application if we can reach it to the end of all these lectures. So what is clinical enzymology, or what are the enzymes? Enzymes are a catalyst that increase the rate of physiological reaction. Each and every reaction in our body are catalyzed by enzyme. In general, most enzymes are present in the cell at much higher concentration than in plasma. Well, we can say that there are 2 types of enzymes, those who are intracellular type of enzyme and those who are extracellular type of enzyme. The intra means inside the cell, the etc means in the cytoplasm. Diagnostic clinical enzymology is one of the major items of the diagnosis. Clinical enzymology is the investigation of changes in the level of enzyme and their correlation to the differential diagnosis of a disease condition. So what is the importance of enzyme for medical schools? The enzyme is the pillar of a healthy person. It is responsible to maintain normal level of nearly all biomarkers that present in our body. So any changes in these enzymes, it means disbalance of this general equilibrium of the markers of the body. And with this change brings symptom and sign for many disease conditions. The enzyme could be directly related to the disease. That is to say, they are the reason behind these disease conditions due to their deficiency or due to their absence. Other type of disease, and we can call them as secondary causes. It means there is other things, other systematic problem that has an effect on enzyme level. So it is related to the enzyme. It is not a direct reason, it is a relation. For example, a patient who is present to the emergency unit with chest pain that's transferred to the arm, the first thing that comes to your mind is that the patient is having myocardial infraction. How to prove that your diagnosis is true is through calculation the level of lactate dehydrogenase enzyme. For example, this is one of the examples that the enzyme can be used for the diagnosis of a disease condition. Plasma enzyme. Enzyme present in plasma can be classified into two types. They are functional plasma enzyme and non-functional plasma enzyme. Plasma-derived enzymes, which are functional, mostly synthesized by the liver, usually decreased in disease condition. Their field of activity is plasma component, and their activity is higher in plasma than in cells. Their clinical importance is limited to the disease related to their own synthesis and function, that's to say, the abnormal metabolism of plasma lipoprotein and blood clotting. Cell-derived enzymes who are non-functional, normally they locate into intracellular compartments. They are non-functional plasma enzyme, very low plasma level, normally exist due to normal wear and tear and diffusion through unchanged cell membrane. Gross damage to the cells are abnormal membrane permeability, overproduction of the higher amount into the plasma. If we can explain what do we mean by non-functional plasma enzyme, let us say that we have patient with liver problem, and inside the liver there are different type of enzymes that are intracellular and enzymes that are extracellular. Intracellular enzyme like serum GOT and serum GPT are protected by the membrane of the cell, so their level in the plasma is limited. But when there is destructive type of disease, like hepatitis, for example, the membrane of the cell will be teared out. It means that there will be an opening to the inside of the cell, and all these enzymes can pass through this pore, this tear of the membrane, to the extracellular compartment, so the concentration will be high. It means that there is destruction in the membrane of the cell. The level of these enzymes also can indicate the amount of destruction, whether it is minor, whether it's major. They are further subdivided into secretory and metabolic non-functional enzyme. Secretory, they are synthesized and secreted by specialized gland into the body, human, mainly for digestion, like in stomach enzyme, maybe gastric enzyme. Metabolic, they are intracellular metabolic enzyme, and their appearance in the plasma is mainly due to cellular damage. Increased non-functional plasma enzyme could be due to increased release and or impaired clearance. Abnormally increased release from the cell may be due to pathological apoptosis and or necrosis of the cell. What do we mean by apoptosis and what do we mean by necrosis? You can Google these two terms in order to understand what do we mean by them. Increased membrane permeability without gross cellular damage, like elevated level of GPT in early viral hepatitis, as we have said in our example. Increased intracellular enzyme concentration due to protein anabolic drugs, like increased instances of liver transaminase enzyme. Impaired clearance is as the case of other related type of disease condition. Other plasma protein enzymes have specific plasma half-life after which they are disposed by cellular reuptake, degradation, excretion in the bile and urine. So the metabolism normal for the enzyme is after we finish the use of this enzyme, the excess amount of enzyme must be discarded. It will represent a waste product that should be discarded through the body in a way that we use either the renal system or the bile system. Examples include elevation of serum leucine amylase peptidase and alkaline phosphatase in cases of obstructive jaundice. Isozyme decreased activity of non-functional plasma enzyme could be due to decreased enzyme synthesis, increased enzyme inhibition, and or deficiency of activation factor, generally inherited as most metabolic inborn error. Urea cycle is one of the important cycles in our body. It has nearly 5 to 6 steps that is included in the conversion of ammonia into urea. Of course, ammonia is the waste product, it is toxic, it should be converted into more soluble compound, which is the urea. This cycle has 6 enzymes. Any defect of one of these enzymes will result in the deficiency of the product and increase of the substrate. It means inborn error of metabolism. Isoenzyme, also known as isozyme, are enzymes that different in the substitution of the amino acid. We have structural type of proteins. It means, what do we mean by that? The sequence of amino acids are constant. When they are synthesized in the body, they are synthesized according to a genetic code. So each amino acid is putting in their proper site. And in the end, we will have this protein, whether it is enzyme or hormone. So each amino acid has its own site. Sometimes only one amino acid is changed. If this happens, it means we have the same enzyme, the same function, the same physiology, but different in their structure by only one amino acid. It is believed to be originating from closely line load gene or formation or from multiple gene loci. Evolution from a single form, possibly due to long-term mutation. They are vary with respect to their kinetic parameters, electrophoresis, motility, and localization. They all have independent action. Example, lactate dehydrogenase have 5 isoenzymes. Enzyme in diagnosis and prognosis. Plasma enzyme activation can be used in the diagnosis of disease and also in its prognosis. What do we mean by diagnosis and what do we mean by prognosis? Diagnosis, it means the first the first things that comes to your mind when the patient presents to you with clinical sign and symptom, depending on laboratory test that you should do to have a decision about this diagnosis. Prognosis, after you give the treatment to your patient, depending on the diagnosis that you made, you should know whether this treatment give the end result, which is a returning of the health of this patient. It means that you should follow your patient, see their biomarkers until you find out that they return to the normal, and this is called prognosis. Plasma enzyme level depend on balance between the rate of influence of active enzyme into the circulation and it is eventual clearance from the blood. As we have said previously, when we finish from the enzyme, after we have what we need from this reaction catalyzed by this enzyme, the excess amount of enzymes represent a waste product that our human body should discard. Localization of damage, enzyme used to measure tissue damage, are present in nearly all cells with varying variety of concentration. So the measurement may indicate an abnormality, but the specific diagnosis cannot be made. For example, if there is a circulatory failure after 3 cardiac arrests, a very high plasma level of enzyme originating from many tissue may occur. This arrest, it means destruction to the cell. Destruction, it means that the cell membrane is permeable, so all type of enzyme, whether intracellular or extracellular, will be out to the etc. compartment. Enzyme originating from many tissue may occur because of the hypoxia damage to cells and reduced rate of clearance. Then the raised plasma level of cardiac enzyme do not necessarily mean that myocardial infarction caused the arrest. So it can be used in the differential diagnosis. When we have the same sign and symptom, the patient present with chest pain. Chest pain has different causes. So you should put in your mind a list for the causes of a chest pain, which one of them is myocardial infarction, angina. So you have to differentiate between these diseases in order to reach to the specific diagnosis. This is what we call differential diagnosis. The diagnostic precision of plasma enzyme analysis may be improved by estimation of more than one enzyme. If you have something in your mind about what is causing this increased level of enzyme, you can do several tests for several types of enzymes in order to confirm your diagnosis. Many enzymes are widely distributed, but their relative concentration may vary in different tissue. Example, alanine and aspartate transaminase are abundant in the liver. The concentration of AST is much greater than that of alanine transaminase in heart muscles. Isozyme determination. Some enzymes exist in more than one form. These isoenzymes may be separated by their different physical or chemical properties. As we have said previously, the isoenzyme is the same enzyme, only one position of amino acids is changed, so their structure is only simply different from each other. This change could also add or eliminate one of the physical or chemical properties. If they originate in different tissue, such as identification, will give more information than the measurement of plasma total enzyme activity. Let us take an example for the creatinine kinase that could be derived from skeletal or cardiac muscle, but one of its isoenzyme is found predominantly in the myocardium. So creatinine kinase 2, if its level is increased more than the creatinine kinase 1, for example, it means that the myocardium has the problem and not the skeletal muscles. Serial enzyme estimation, the rate of change of plasma enzyme activity, is related to a balance between the rate of enzyme and the rate of removal, as we have said also previously. Persistently raised plasma enzyme activity is suggestive of a chronic disorder, occasionally for impaired clearance. The distribution of enzyme within the cell may differ, like in ALT and LDH are predominantly located in the cytoplasm, while the glutamate dehydrogenase is predominant in the mitochondria. This table shows you different types of enzyme and their clinical significance. Creatinine kinase is one of the important enzymes that can be used in the diagnosis and in the prognosis of different disease conditions. Creatinine kinase is generally associated with ATP regeneration in contractile or transport system. It is a predominant physiological function occur in the muscles, where it is involved in the storage of high-energy creatinine phosphate. Creatinine is widely distributed in tissue, with highest activation found in the skeletal muscle and heart muscles. It's present in much smaller quantity in other tissues, including the bladder, placenta, gastrointestinal. Diagnostic significance: because of the high concentration in the muscles, creatinine levels are frequently elevated in disorder of cardiac and skeletal muscle. The creatinine kinase level is considered a sensitive indicator of acute myocardial infarction and muscular dystrophy as well. Total creatinine kinase levels are not entirely specific indication as much as the creatinine kinase elevation. Level of creatinine kinase also vary with muscles mass and therefore may depend on gender, age, race, degree of physiological activity. Elevated creatinine kinase levels are also occasionally seen in central nervous system disorder. Creatinine kinase isoenzyme elevation is found in numerous disorders. The separation of total creatinine kinase into its various isoenzyme fraction is considered a more specific indicator of variation of different type of disorder, like hypothyroidism, for example, result in the creatinine kinase elevation because of the involvement of muscular tissue. These tables show you creatine kinase, isoenzyme, tissue localization, and source of elevation. It has been observed that creatine kinase, BB for example, may be significantly elevated in patients with carcinoma of various organs. The value of creatine kinase isoenzyme separation can be found principally in detection of myocardial damage. Tissue source for lactate dehydrogenase it's widely distributed in the body. High activities are found in heart, liver, skeletal muscle, kidney, erythrocyte. Diagnostic significance because of this widespread activity in numerous body tissue. Lactate dehydrogenase is elevated in variety of disorders. Increased levels are found in cardiac, hepatitis, skeletal muscle, and renal disease as well, in several hematological and nephrotic disorders. Liver disorders such as viral hepatitis, cirrhosis, show slight elevation of 2 to 3 times. Lactate dehydrogenase isoenzyme assay therefore assume more clinical significance when separated into isoenzyme fractions. Lactate dehydrogenase have 5 different isoenzymes. These 5 different isoenzymes concentration are different in the various tissue distributed. For example, the it means it's high in the muscles more than in the heart. The enzyme can be separated into these 5 major subdivision, each comprising 4 subunits. It has a molecular weight of 128 Dalton. Each isoenzyme comprises 4 polypeptide chain with a molecular weight of 32 Daltons. Table 3 indicates the tissue localization of lactate dehydrogenase isoenzyme and the major disorder associated with elevated level. Aspartate transaminase is an enzyme belonging to the class of transferase enzyme. It is commonly referred to transaminase, and it is involved in the transfer of amino group between aspartate and alpha keto acid. Pyridoxal phosphate function as a coenzyme. The reaction proceeds according to a specific equation. The transmission reaction is important in intermediary metabolism because of this function. The keto acid formed by the reaction are ultimately oxidized by the trans-carboxylic acid cycle. Transaminase action can be seen in the urea cycle, in the formation of urea, where all the type of amino acid converted into urea. When you have a specific reaction that needed a specific type of hormone or enzyme, the chemical nature of this hormone or enzyme is protein. So first it will be synthesized. After finishing this reaction, there will be an excess amount of this enzyme. And as we have said more than once, it should be discarded because it represents a waste product. So again, it will be distracted into the amino acid that they formed it previously. So the amino acid have carbon skeleton, have amino group, and have a carboxyl group. The amino group is converted into ammonia, and the ammonia should be converted into urea. Transaminase plays an important role in the conversion of ammonia into urea. So diagnostic significance for transaminase enzyme. The clinical use of AST, for example, is limited mainly to the elevation of hepatocellular disorder and skeletal muscles involvement. AST elevation are frequently seen in pulmonary embolism. The acute myocardial infarction AST level begin to rise within 6 to 8 hours, peakly at 24 hours, and generally return to normal within 5 days. AST level also may be increased probably in infection of liver. Skeletal muscle disorders such as muscular dystrophy and inflammation condition also could increase the level of AST. The reference range is between 5 to 30 international units per liter. The other transaminase enzyme is the alanine aminotransferase enzyme, where it transfers the enzymatic activity similar to that of AST. ALT is distributed in many tissues with comparatively high concentration in the liver. It is considered the more liver-specific enzyme of the transferase enzymes.